We're talking about the trend of millennial women determining they do not want to have children and getting sterilized at a young age. I think this whole informed consent, talking to a psychologist, as Dr. Minaya alluded to, I think that's very, very important to really drive home the permanency that it's a lifetime decision. If this is your decision, you can live with it, then by all means go ahead.
Absolutely.
And the other thing I thought of, that ultimately it's your decision. Guess what? If you can't have a baby and you're in a relationship, whether it's with a male or a female, you want to have a family, adoption is always a super great option.
Oh yeah. I always talk about, this is one thing, if I can say this, when I finally found the doctor that I found, she was like, what if you did change your mind? And I was like, well, I know for me personally, no matter what anyone says, I feel that I know myself best. I know what I would do if I got pregnant and it wouldn't be going through with it. So if I change my mind, adoption is a valid option. In our society, some people in our society kind of stigmatize adoption, which isn't really fair because adopted kids didn't put themselves in that situation. Like if I regret my choice, there are options for me. And I've thought about all
Absolutely.
That's true.
Good point.
Yes.
Yeah.
Dr. Putnam, do you think the doctors who won't perform the surgery are practicing standard of care?
Yes, I do still think they're practicing within the standard of care because I don't think anyone should operate or do something that they don't feel comfortable on. And I don't think anyone should operate, especially on a patient that they don't feel that they're doing the right thing for them. So, I think it's still within the standard, but I think the obligation of that doctor is to say, hey, I'm not comfortable doing this. This is not something I recommend for you. I have problems with you being so young. It's just, I know people change their minds and there's a big factor of regret for young women doing this. So I'd like, I don't feel like I can do this for you. And I'd like you to see somebody else.
I agree.
Without shaming them, without judging them.
Yes.
Just saying, hey, I have this other, and hopefully you can have a couple of people in the area that somebody can see. The problem is that a lot of women don't have access to even basic birth control or someone who's happy to do sterilization and with the insurance limitations and things. So I think the number is very limited.